Okay.
It's really, really nice. I really like you for saying that. Maybe I'll grab one of them to show you. So what you do is, it's called an IV catheter.
Huh.
Pretty cool.
Yes. I'm trying to process.
I know, it's a lot.
It's a lot of information.
It's a lot of information, yeah.
Yep. Doctors.
Yeah.
Don't fear them.
Don't fear them, no, definitely not.
Hi guys, and welcome to another And Oskar Goes To video. I will be interviewing Lauren Hawkins, and we will see how it goes. I really don't know. If you want more content like this, don't forget to like and subscribe so that I will make more interviews like this. Let's go to the video. Hi, Lauren.
Hi.
So, what is your profession?
I am a nurse, actually.
You're a nurse.
Yeah.
All right, cool. So, you know, I know that you work a lot with IV treatments, and a lot of patients like me can be scared of like needles.
Of course.
So, how would you deal with like people who are afraid?
That's a great question, Oskar. So I'll tell you a little bit about my background. I used to work in the hospital. I was a cardiac ICU nurse, which means I worked with patients whose hearts were really, really sick. And sometimes we would have to replace hearts. We would have to maybe put a new valve in, or anything that involves the heart we would deal with, and the really sick patients. And then I decided to start my own company. And now we do IV treatments, we do vitamin injections, and definitely one of the things, people are most afraid of, I think, is needles. So how I tell people to sort of think about it is, we try to do what we call distraction technique. So we try to talk about something else. I ask them about their weekend, their day, and then usually the trick that I find works really well is, instead of a 3, 2, 1 going on the 1, you kind of go on the 2. And they aren't really expecting it, so they don't tense up as much, and that actually works really well.
Because I heard if you like tense up, it's gonna hurt even more.
It
right?
is.
So you just gotta relax.
You gotta relax.
Right.
That's the most important thing. You gotta relax, because otherwise, when you're really tense, it pushes the muscle up toward the vein more.
Really?
It does, yeah. So when you're relaxed, it's a little more, soft, right? And then when you tense up, it's gonna hurt a little more. That's correct.
So why would you say people have started this new trend of IVs?
It's a great question. So, the trend actually started, I would say, like healthcare workers, when they were sick at work would say, oh my gosh, like, let's do an IV quickly, right? I think that's kind of one of the common things they say, right, in the ER or something. But what it does, it's going to give you hydration, right? So we have a few different fluids we can work with. The most common is probably normal saline. Think of it like a salt water. And so when you infuse that, you can infuse different amounts, and it helps to rehydrate the body, because unlike the GI tract, when you infuse something in a vein, you're actually getting 100% of what you're putting in. In your GI tract, which is anything you eat through your mouth, drink through your mouth, absorption is not 100%.
Really?
There's a variation, yeah, I know, pretty crazy. So, but once we're putting it in that vein, you get 100% of fluid, vitamins, whatever medication you're putting in, and it goes right into your system. So it's actually ready for immediate use by your body.
So you're telling me like you could fill your whole body with nutritions and like water and stuff, and like it'd be better than if you just put it in your mouth?
Well, it wouldn't be better, but we definitely, for patients who aren't able to eat or ingest food or liquids for certain reasons, we can actually give them all their nutrition through a line, whether it's an IV or something a little more permanent. And we do IV fluids, and then something we call TPN, which is basically the nutritional components of what a body needs to be functioning. Some more, sugar components, protein, things like that. So yes, you can. Not that I would recommend it for you and I, who are very healthy people.
Yes.
And it's important to get nutrition in your GI tract, because some things do need to be absorbed there over IV. So yeah, but it is a really, sort of, I would say, blossoming industry, in the sense that, people realize that they can get their hydration and their vitamin components, especially people who suffer from vitamin deficiencies, or
What is that?
They just wouldn't have enough that their body either absorbs or that is in their system.
And then you would need to have like an IV for nutrition. Okay.
Correct. So example, one of the things we do is B12. And B12, there's actually a lot of people who are deficient, and specifically people who don't eat meat are actually usually deficient. And one of the main, signs of a deficiency that is a symptom is you're really tired. And that would be something, you're just tired all the time. So if we can give you like a little injection once a week of B12, that boosts your levels to a normal level, right? So that's kind of a good example of one of the things. And B12 is involved in a really important part of the blood called the hemoglobin. So we want to make sure we have enough of that in specifically red blood cell production.
Yeah.
Yeah. So that's kind of one of the main examples.
Got it. Why would people get IV treatment, like for health reasons or like what?
Yeah, so basically I would find a lot of our patients now, I'll kind of tell you, so we have a lot of athletes we see, and they'll do just pretty much basic fluid with maybe B12 added, maybe a little vitamin C before games, because if you think about it, during a game, they don't want to be drinking too much water. You want to already be hydrated before you're going into that game. So we have a lot of athletes. Then I do see people who are sick, right? They might have a cold or flu or food poisoning, and especially with food poisoning, you're losing a lot of fluids.
Yes.
And right, when you're really sick and you can't really eat or drink anything, the IVs are really good for that. So I'll see people who are sick, and also now when we're sick, we don't really want to go into the emergency room or urgent care. You already feel bad. So if I can come to your house, much better.
Perfect.
And we're going to be doing the same things that we would do in the hospital. We can give a few medications that will help with the vomiting and help with the headaches.
Absolutely.
For sure. And then, some people, this is kind of just they find that they function better doing this once a week. And so they come in as well. So we have people of all different backgrounds for all different needs that kind of come in for this. Traveling is another one. People find, when you're on an airplane, it kind of sucks that hydration out of you. You feel really thirsty and that air is circulating around. So this helps you not to get sick on the plane.
Speaking of athletes, I read that like a lot of famous people want to get IV fluids. Did you ever treat a famous person before?
Quite a few. I would say on a weekly basis. Yeah, I would say it's so funny because a lot of them use aliases, and you walk in and you go, "Oh, I know who you are." So it's pretty fun. Yeah, it's great. But you know what I have to say? Everybody's always so nice, and they're just people like we are.
Exactly. Well, whether you're famous or not, you need the same treatment.
Correct. Now we're all human.
Yeah, exactly.
We are all human. Yeah.
This is a pretty big question. Are the IVs covered by insurance?
That's a great question. Sometimes yes, and sometimes no. A lot of it is out of pocket, but we can, for people who have it ordered by their primary, or say they're, maybe they're a cancer patient or something like that, they probably will get it covered by insurance. But yeah, great question. And definitely, if you're getting things in the hospital, most likely they're going to be covered by insurance. We're what we call an outpatient. So outpatient just means external to the hospital, and we call it elective medicine. And elective medicine is when someone decides to get a treatment that may not be totally medically inclined, right? Like their provider wouldn't say like an IV a week, although it is getting a lot more common, and we're seeing that people are functioning so much better and not getting sick. So I think there is this movement that I think eventually we probably will be able to cover it completely by insurance and by healthcare.
So like people who are, like you said, athletes, that wouldn't be covered by insurance. That
Correct.
Would be, okay, got
so
it.
that would be usually what the athletes, it's their teams, and the team doctors will say, we want you to get 1 liter of normal saline, and then I'll go and I provide that.
Yes.
And sometimes, traveling with the teams as well has become a common thing. Sometimes they'll, we have a good relationship with a few of the teams, and they like to have the same people, right? It's like their little circle. But the team doctors will generally recommend what they want.
Yeah. Have you personally ever taken an IV?
Great question. I do once a week, actually.
Once a week,
Once a week.
okay.
I had my last one on Saturday.
Ooh.
One of my nurses gave me the IV,
Cool.
and I got B12 in it. I got B complex, which is a combination of the rest of the B vitamins. There's about 7 of them in there. Vitamin C,
Yeah.
magnesium, zinc, biotin, which is great for skin, hair, nails. And then I think that was it, actually. Yeah. Oh, and a little bit of NAD. And NAD is this really interesting component that's involved in every cellular process of the body, right? So I almost think of it as like the food of the mitochondria, which is the powerhouse of every little cell. And so it eats this NAD and it gives it nutrition almost. I think of, it as its own little organism. And low levels of NAD have been linked to early onset issues with your brain, right? So maybe Alzheimer's, dementia, where people have, memory issues. So if we infuse this or we do consistent, injections, it actually helps us not to age as quickly. But yes, to answer your question, I do IVs a week, and I'm hoping to live forever.
Cool.
Yeah.
Would you say that IVs, like, how do they change people, like, in a positive way? And if it's a positive way, how would they change, like?
Right. Well, I think one of our things we say is we want, even when you're feeling great, we want you to feel better.
Better.
Right? And so I think the idea that, if you're sick, oh yeah, you're definitely going to feel better. But even when you're feeling great, there's always that little percentage of
A boost.
a boost, we call
Yeah.
it. Exactly. And we think of it as a little boost and a little bit of that extra energy. And us adults, we have so much going on. We need that little extra boost, especially, like I said, the B12 is such a great one because people feel that little energy spike. You might get a little bit more done, or your work might be a little easier, or you might be a little more focused.
Is that why it's called B12? Because, like, you're feeling 12?
That's I love that. Honestly, I'm going to start using that.
Really?
Because you're feeling 12. I do.
I feel 12. I mean, I am 12.
You are
I feel
12.
absolutely cool.
Well, hopefully you can stay feeling 12 forever.
I think everybody wishes that.
Yeah.
So, I want you to, like, walk me step by step of how, like, an IV gets done.
Perfect.
Yeah.
You got it. All right. So, first and foremost, when you are assessing a patient, right, you're going to look for, we call this the antecubital. That's this area right
The
here.
what?
The antecubital, or the AC.
AC. Okay,
This is the
easier.
AC. And this is a very common place to place a line, as we call it. Sometimes the hands too. And a lot of people, you want to look, but ultimately it's a feel, actually. So what you want to feel is a nice bounce of the vein. Then that's a good place to go, right? So right there. And then what you're going to do is you're going to tie it off, right? And so you're going to tie it off with this tourniquet. And then what that does is it helps it to sort of pop a little bit more, as we say. So you can see right there, right? You can see that spot. Do you want to feel it? So you feel the little bounce?
Yeah, I do.
Okay, perfect. So then you're going to leave this on. I won't actually do it.
I know, yeah.
And then next thing, very important, you're going to clean with alcohol, right? And one of the things that's really important is when you clean, you want to use friction, because the friction helps the bacteria that lives on the skin to actually be cleaned off and go away. So we don't have any, risk of infection when you actually puncture the skin. We don't want to bring that stuff from the outside world in. Because your skin is actually your biggest organ, and it protects your body. Yeah.
I never knew that.
Yeah. So it's a very strong barrier, right? It's helping, the world not get inside into your organism, right? Then the next thing you're gonna do is this is the actual IV. So you imagine having the blue tourniquet, you do your cleaning, and you decide where you're gonna go. You say, okay, that's a good spot. So, and you have gloves on, obviously. Obviously. Yes. And then this is the IV, right? Okay, so this is actually what we use to place the line. You take this cap off, and this is the actual IV.
Yeah.
And so this, you make sure it's nice and loose. And what we say, do you see this little piece right here that's kind of, it's open, but it's kind of like up?
Yeah, I know what you mean.
That's called a bevel. And so you want to make sure the bevel is up when you actually insert the IV. And what what we teach everybody is you want to land it like an airplane. You don't want to land the airplane like this. You're not landing it like this. You're not landing it like this. So you kind of land it like this. And that's how you actually insert it into the vein, right?
Oh.
And then what happens is you'll see some blood return. So you know you're in the right place. And then this is the actual needle that you contract out of the actual IV. This is what actually sits in your body. And this is like a little plastic hose.
Oh.
No needle. So the needle actually doesn't stay inside. It's just this little piece here. And then the other thing you want to do, you'll attach this, we call this a flush, and it has saline. And you attach it to the end, and you pull back this, and you see a little blood, so you know you're in the right place, and then you flush it in, and then you tape it down.
Oh, and that's how
your
it
IV.
goes into your body?
And then this little piece, and so everything goes through here, and then you can attach an IV, you can push medications, but this is also really an important piece because it keeps the inside of the body protected. It's like a little gate, so none of the bacteria can go in.
How do you do this?
Learn.
How do you, no, I mean
it's a skill.
Mentally, how do you do it? How do you deal with the blood and everything?
I mean, hopefully there's not a lot of blood coming out, right? You're keeping the blood in the body, right? So if you're really good at what you do, it's nice and clean.
As a nurse, what would you say you do not like about your job?
Oh, that's a good question. So we say in the nursing profession, everybody has one thing that they don't love. I would say, generally speaking, people aren't as nice as you think in the hospital. They can be pretty mean to nurses, and I've definitely had stuff thrown at me. I've had kind of crazy stuff, which they don't tell you in nursing school about all the crazy stuff. But everybody has one thing they don't like doing. I think mine is probably, we call them trachs, and it's when someone has an alternate airway and you have to pull out the cannula to clean it, and it's usually covered in a lot of gunky stuff, and that's definitely not my favorite thing. It's a little gross. It's like the slime fest,
Think of flowers and butterflies. Flowers and butterflies. Okay,
flowers, that's exactly what I would have to do.
Okay.
This isn't happening, you say. This isn't happening.
It's like a nightmare.
Yeah, not great. Not my favorite
Let's
part.
go to the other side of the argument. What do you love about your job?
Oh, I mean, I love people. So for me, I love taking care of people. I love when they get better, right? Like seeing someone go from so sick to, living their life is great. But then on the other side, I just love interacting with humans. And so for me, I get to do that with every patient I see, right? Part of it, a big part of nursing is bedside manner. I always say the nurse is sort of, you think of the nurse as the translator between the doctor and the patient, right? We're the ones who are supposed to, kind of explain what's happening. We spend the most time with the patients. We're there 12 hours, 24/7, 365, and the doctors will come in, for 5 or 10 minutes. So you think of the nurse as like the eyes and ears for the doctor, but then the translator for the patients. That's what I say.
I think that's an amazing explanation of that. And I want to talk about education, right? What kind of education do you need to get to be in this professional field?
Great question. So nursing school is 4-year college, right?
4-year college.
So what I actually did, I have another degree that I got before. So I went to college for 4 years and got a business degree. And then I went back to school and then I got a nursing degree. So basically, you have to do 2 years of prerequisite courses. So biology, chemistry, anatomy and physiology, things like that are going to kind of prepare you for the really 2 intense years of nursing curriculum. So it's a 4-year degree. So you do your 4-year degree and then you graduate, and then you actually have to take a licensing exam called the NCLEX. And the NCLEX is basically going to just make sure that you have all the information you need and you understand it to be a nurse in practice. And the tricky thing with the NCLEX is that it covers, it could be anything you learned over those 4 years, like anything. And so they could ask about a baby, they could ask about a really old person, they could ask about a heart condition, they could ask about
anything,
diabetes, right? So they could ask about anything. So you got to really be prepared going in there. And then once you pass that licensing exam, then you can practice nursing.
So I'm sorry, you said you went back to school?
Yes, so I have 2 degrees. It was very unusual.
Hold on a second. Wait, if you said you went back to school. You know, that's really ironic. I'm gonna show you something.
Back to school. Back to school. Dad, I got a
That is so funny.
I'm sorry, I had to pull that off.
I love that you know that. That's a little out of your age range, but I love that.
I love that movie. I love it. I love Adam Sandler. What would you say is your craziest, just complete craziest of your whole life nursing experience ever?
Well, I think one that probably, a lot of people don't think about that we do in the hospital a lot, especially in really, really sick patients and really critical units like an ICU. When someone has a cardiac arrest, right? They flatline.
Yeah.
Their heart stops. Something happens. And we actually do chest compressions.
Yeah.
And I remember the first time we call it coding, when they code, and it's, the code is called and everybody rushes in and you start your chest compressions. And I think we had been maybe 10 minutes or so. And while I was doing the compressions, the patient actually came back. And I think that was probably one of the good, craziest things, I think. The feeling of that is like, there's a lot of adrenaline for sure.
That's
for
insane.
sure, yeah. But then there's the good, the bad, and the ugly, right? Like it's medicine, and so we have great outcomes, and then there's sad things that happen too.
At which point of your life did you pursue in this career?
Great question. So I was, I think, 24.
24.
Yeah, 24. And I'd always really been interested in medicine, but just kind of never thought I could do anything with it. I had been injured. I was a ballet dancer for a long time, and I had a lot of injuries. And when I had surgery, I was like really interested in how to get better in the body and how the surgery, and actually ended up watching the video of the hip surgery I got, which was the surgeon was like, no one watches these. But it was very interesting to me. And then I like helping people, so that just made sense.
Freestyle question.
Go for it.
If you could have, I'm sorry, I need to exaggerate. I'm the drama queen. If you had any job to pick, I'm the genie. You get one wish, but it's about a job. If you had any job, you could any in the world, what would it be?
That's a great question, and it's gonna sound maybe like boring but a little crazy. I would be like a pop star, like Beyonce, or like, who I really like?
Like me?
Yeah.
I'm kidding.
I just, a pop star who can belt it, but also gets the costumes and then also gets to just dance for a whole show.
What genre would you do?
World.
What genre would you do? Like just.
Great question. I'd probably like something like her where I could belt it out and just had this great voice. I have the worst voice in the world.
Yeah.
So it's sort of this like treat you never want to hear me sing. But I think that would be so fun.
I think you make a great singer.
Thank you.
I mean, I've never
you haven't heard
you
me sing, and I don't think you ever want to.
No. I'm sure you sing amazing. I'm sure you
Only
sing
in the
amazingly.
car. Only in the car by myself.
In the car.
Yeah.
In the car. Usually people only have like a choice for 1 or 2 jobs and they can't pick any more.
Yeah.
I wish people just had more time to like have like any job, like explore what they want to do.
Well, a lot of that
like
people
that'd
get,
be cool.
stuck in their ways, right? Or, they gotta get a paycheck and then, or they think, oh gosh, I can't do that. But I think I agree with you. I've done a lot of things in my life and it has actually made me so happy because I get to sort of sample all these little things, right? But, some people I think like maybe our grandparents, they were you would get one job and you'd stick with it forever.
Yeah.
So I think we are changing in that way, which is good.
I think we are.
You can literally do whatever you want.
I probably actually
you-
want to be, well, probably an athlete is first, but if I think more like, I'd probably want to do this, interview a bunch of people, like be
I think
like,
that's great.
be like a Jimmy Kimmel,
Guess what? I think you've got some time to work on it. I think you could make that happen.
Now
You've got time
Yeah.
on your side.
I do got a lot of time. Now, guys, do you want to see Lauren teach me a lesson?
So should we see my vitals?
Yes, let's do it.
Okay.
I'm very anxious to
So I'll tell you, so this is a blood pressure machine which we use. We use a lot of machines in the hospital, but you can actually do what we call manual blood pressure, which you would have a cuff that you pump up with your hand, and then you listen with the stethoscope, and there's a way of counting and understanding how to do it. For this sake though, we will do it this way. So I'm gonna have you put the cuff on my arm, and you're gonna place it on my upper arm, okay?
Yeah.
And you can kind of, it's very sticky.
Yeah.
I think this one is a little big for you, otherwise I would do one on you. So you see how the cuff is placed, right?
Yeah.
And so you kind of want this little arrow, if you see the arrow, you're gonna try to get that like right here-ish, okay? So you wanna put it on my arm?
All right, yeah, so like this,
Okay.
like all the way up to
And
here.
it's gonna go up to there, yeah, and then make
then,
it like pretty tight.
Pretty
You want
tight?
it pretty tight, yeah.
This.
Yep,
And then,
okay.
like, tie it around.
Pretty good.
this?
Yep.
Doesn't it like pressure?
Yeah, so you
pressure?
can do like even
Even
a
tighter?
little, pretty good. So you say like maybe one finger, maybe two. So now what you're gonna do, and you want the person to have their feet on the ground,
Not crossed.
not
That's what I hear a lot of
crossed, not
doctors
crossed.
say, yeah.
You want them on the ground and sitting upright.
Yeah.
And then for this, you're just gonna press the start. And some people have what they call white coat, and I should probably be quiet for this, so we'll see. Go
All right.
for it.
Yeah, it's tightening. Okay. Very interesting. Okay, so we got 131/84.
Do we think that's normal?
Well, I know
That's
you
actually
said.
a little high for me.
I know you said that.
Only because I've had coffee and I've been talking, but usually I live in like 110/70, but
So you want usually the
so this is
you want
so,
the higher number to be higher than the lower number.
So yes, the higher number, so we call it the systolic. That's the one that we said it should be between 100
And,
140-ish. And then the lower number can be between 60 and 100.
60
So we're
and
good there.
100.
And then this last one is the heart rate.
Heart
so what
rate,
we
yeah.
said, that's good between 60 and 100. So we're
79. Is that good? That's perfect.
good to go. Good to go. So that's your vital signs. And there's a few things. We'll also do a temperature, and we'll look at some other stuff too. But that's sort of a basic blood pressure.
Thank you
And-
so much.
Yeah,
I learned a lot
absolutely.
from this. And one final question to go. Oh, I wish I had something to go. I'm hungry. Sorry, getting off topic, thinking of food. What advice would you give me for my career or like any career path I go down to?
That's a very good question. I would say, don't be afraid to try something, even if it scares the life out of you. Because every experience you go on is going to be part of your journey, right? It's going to teach you something, whether it's a good lesson, a bad lesson, a hard lesson. So if there's something you want to try, do it. Don't hold back. Don't feel like, oh my gosh, I can't do that, or I don't have the skill or whatever. That's the biggest thing, because you realize as you get older that all your experiences are part of where you are today, right? Like
Yeah.
I wouldn't be here if I didn't dance and I didn't get injured and and then I didn't
Yeah.
have the injury that made me interested in nursing.
Yeah, exactly.
So like everything matters, even if you think it doesn't at the time.
the domino effect of life.
The domino effect of life. So don't be afraid to try things. Whatever you do, give it your full effort, and that's all you can do.
This has been a very interesting interview. Thank you very much.
Thank you so much. That was so much fun, and I wish you the best.
Thank you. Bye, guys.
Bye.
All right, that was super fun. I hope to see you in the next one. And I don't know, maybe write in the comments who you think I should interview next, and I will definitely take a look at that. Who knows, give me some fun ideas. See you in the next one. Bye.